Syntacculum, I've confused it with the navicular tuberosity. So where was it again?
Okay, navicular tuberosity is going towards that first MTP, that line, that first third. So I'm traveling away from my ankle in an anterior direction. So there's the navicular. The syntacculum tali is going straight down from, or straight up from the medial tuberosity, and you'll find a small bump right there. So in reference point, the syntacculum tali is posterior to the navicular. See the difference?
Good question, Jay.
Yeah, that was a good one. All right, so that's all the bony landmarks. Let's go to the soft tissue. ATFL, what does that stand for?
Anterior talofibular ligament.
What's significant about this ligament? Yeah, you sprain it a lot, right? So we'll step in a hole or we're turning and we turn our ankle off a curve, right? And you're going to put a stretch or a pull on the ATFL. So to palpate this ligament, we have another kind of weird name. You have this little groove right here, or a fossa, called the sinus tarsi. Okay, that's different than the syntacculum tali, and it's something that you don't have to palpate, but that you want to know when you're palpating the ATFL. So, what two bones does this ligament attach to? Yeah, it's the name. Fibula, right? So talus we just palpated earlier. It was right in the middle, okay? Fibula's here. So we're coming towards the kind of lateral portion of the talus, okay, right in there. And there's a little kind of indentation right there, a little kind of a hollow, I think is what your notes say. And that's a sinus tarsi. So I go in that little hollow there from your fibula to the talus, and I feel kind of a little stringy structure, and expose it. I'm going to perform or go away from exactly inversion or supination. And supination is just a combination of plantar flexion, inversion, kind of forefoot adduction, going away from the lateral ankle. So just the way you kind of would sprain the ankle, you turn the foot in that direction. Okay? Right next to it, people think it's going to be the posterior talofibular ligament, but it's not. It's the calcaneofibular ligament. Posterior is going to be actually behind here, where the talus kind of comes deep back behind the fibula. So the calcaneofibular, you look in your notes and it says to use the peroneal trochlea, which is a little bump on the calcaneus down here where I'm poking. So remember, when I was on the medial side, it was soft, and I came up and I felt a structure called the syntacculum tali, but now I'm on the lateral side. So this is where people were getting confused, as they were feeling the small bump on the calcaneus, and that's the peroneal trochlea, which we use to get to the calcaneofibular ligament. Okay, so there's all these bumps on both sides of the foot that you want to make sure you can separate them and get the right term down. So there's this small bump on the calcaneus. Now I travel up, and the ligament kind of going straight down, maybe a little bit posterior, is going to be the calcaneofibular ligament right underneath the fibula. And to expose this, instead of putting him, I would also put him on an inversion or supination, but I want to put him maybe more on a calcaneal inversion, where I pull the calcaneus over as instead of the kind of pulling the forefoot over. Does that make sense? Okay.
Question? Was a small bump on this that you just palpated?
On the calcaneus?
Yeah.
Peroneal trochlea. I don't really use that landmark too much. It's in your notes. Like if I'm getting to this ligament, I'm coming straight off of the fibula and going straight down, maybe a little bit posterior towards the calcaneus. There's a little space right there. Palpate it and then bring that calcaneus into inversion, and that's fine. The reason why is because you have two tendons coming underneath that fibula. What are they? Peroneus longus and brevis. And they're going to be running right where the calcaneofibular ligament attaches. So if you have the person, and that's why you have this trochlea there, because those two tendons run in between that peroneal trochlea and the lateral malleolus to insert where they at their insertion sites. So that's why it's named that. kind of as a little bridge there for those two tendons to run along. But that's why when you're exposing it, you want to passively pull his calcaneus away from that ligament. That way you don't activate, or you don't have him evert or activate those tendons, because they'll kind of push into your fingers as well. Okay? So we have 3 ligaments here, 2 that we're palpating. One is the ATFL going kind of forward, and one's going straight down, maybe slightly posterior, called the calcaneofibular ligament, attaching the calcaneus and the fibula. All right, tendon of the peroneus brevis. So we just palpated the tubercle of the 5th metatarsal earlier with bony landmarks, so we can just use that as our reference point. So I'm on the base of the 5th met head. The peroneus brevis is going to come underneath, wrap around the lateral malleolus, attach there, so I'm really close to the insertion site, and then I'm going to have him evert his foot, and you can see his peroneus brevis tendon without even poking on it. It's that guy right there. So I palpate it, he everts, I offer a little resistance, and I feel it very, very good going to my fingers. Okay? The longus, and people were asking a lot of questions about the longus because they run right next to each other. The brevis is in front of the longus, and the longus you're going to want to palpate higher up. The reason why is because the longus doesn't attach to the 5th metatarsal. It wraps around and attaches to the 1st cuneiform and the 1st metatarsal underneath the foot. So brevis stops there, longus wraps around. So if I get longus in the palpation exam, maybe I use brevis, come off of it, so brevis is in front, longus is right behind it. I come a little bit higher up behind the lateral malleolus, and then the action is going to be the same. I ask him to resist eversion. Okay, and you can see that right there. His tendon kind of stick out. Go ahead and do it again. The brevis, peroneus, longus, and brevis are right next to each other right here. And if you palpate it, you can kind of separate the two higher up. When you palpate the brevis, palpate it close to the foot. When you palpate the longus, more a little bit proximal towards around the ankle. Okay, don't go too high because it's asking you to palpate the tendon, and then you'll be on the muscle belly.
So for that one, we technically go off the lateral malleolus posterior, and then set this area stays right there, and then
Evert. There. That'll be fine. All right, Achilles tendon. It's right here. Check. Check. Yeah, you flick it. That's a test that you do during the. No, you don't do the test. I'm just kidding. So he can be here. So when it says supine, you can do this in sitting, in supine, long sitting, whatever you like. What are the 3 muscles that make up the Achilles tendon? Gastroc soleus. Those are good. Those are the obvious ones. There's one more. Yep, plantaris. So you can tell me that, or you can say, Achilles is the tendon of the calf muscle. It's right behind the ankle, attaches to the calcaneus, and then have him perform the action of ankle plantar flexion. Go ahead and come up on your toes. There you go. Okay. Kind of hard to do it in that sitting position, but you can do it in a regular sitting position. For this one, that's enough. You don't have to resist like this necessarily. As long as he comes up on his toes in either position, it's going to pull that tendon into your fingers. Okay? Because the reason I say that is because when we're testing calf strength in the clinic, we don't do an MMT with our hands. We see how many single leg calf raises they can do. 20 being 5 out of 5, and then repetitions. If they can't get to 20, certain repetitions would lower their MMT grade. So it'd be a good practice for you to palpate the Achilles tendon by just having them do plantar flexion on the ground or on the floor or on the table.
Why is it called Achilles?
What was that?
Why is it called Achilles?
Why is it called Achilles? Because Brad Pitt played him in the movie, and he was really good looking.
Oh, so they named that tendon after he was born?
Yeah, after Troy.
After Troy.
After the movie. Yeah. So no, I know the reason why they call it Achilles, but do y'all know the reason why they call it Achilles tendon?